Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Signs of dehydration in newborn and younger babies. Dehydration happens when babies lose more fluids than they drink. Babies are more prone to dehydration because they need more fluids and lose them faster than adults. Illnesses such as stomach bugs that cause fever, diarrhea, or vomiting increase the risk. /r/n/r/n Until age 6 months, babies get their fluids from breast milk or formula. After 6 months, they can have small amounts of water, but breast milk or formula should be their primary fluids until they reach 12 months. A healthcare provider may suggest an oral rehydration solution, ORS, like Pedialyte if your baby is sick. Early signs of dehydration include a dry mouth, darker urine, pee, and fewer wet diapers. /r/n/r/ndesign, Getty Imagesrnrnrn Dehydration in breastfed babies can result from :r/n/r/n oral symptoms of dehydration in babies include /r/n/r/n Dehydration can result in mood and behavior changes like /r/n/r/n if your baby is sleeping more than usual, it could be due to a growth spurt or a busy day. Normally, they'll wake up alert and ready to eat or play. But if they're unusually hard to wake or seem very weak, they could have dehydration or an illness that needs immediate medical attention. /r/n/r/n Dehydration can make a baby's skin. /r/n/r/n Urinary signs of dehydration include /r/n/r/n After the first week, breastfed babies usually have mustard yellow, greenish, or light brown loose and seedy stools. Formula-fed babies typically have firmer yellow to brown stools. If a baby doesn't have enough fluid, their body reabsorbs water from the digestive tract, leading to /r/n/r/n in the first few days of life. Expect 1 or 2 wet diapers and 1 to 3 dirty diapers daily. From day 4 onward, expect 6 to 8 wet diapers and 3 to 6 dirty diapers daily. /r/n/r/n Fluid loss in and around a baby's eyes can cause /r/n/r/n The anterior fontanel is the soft spot on the top of the baby's head. It should feel soft and level with the skull. A sunken fontanel could be a sign of dehydration. /r/n/r/n Additional signs of dehydration include /r/n/r/n Minor signs of dehydration that you may be able to treat at home include /r/n/r/n If your baby has mild dehydration, let your child's healthcare provider know. /r/n/r/n Signs of moderate dehydration include /r/n/r/n For moderate or worsening symptoms, go to urgent care if your provider isn't available. /r/n/r/n Poor skin turgor means your baby's skin is less elastic. To check, gently pinch the skin on the back of your baby's hand or belly. If the skin stays pinched and doesn't bounce back quickly, it may indicate dehydration. /r/n/r/n Severe symptoms of dehydration include /r/n/r/n Seek emergency medical help immediately for severe symptoms. /r/n/r/n For mild dehydration, offer more breast milk or formula. Your provider may suggest small amounts of oral rehydration solutions, ORS, like Pedialyte to replace lost fluids and nutrients if your baby is sick. Follow these guidelines. /r/n/r/n ORS should complement, not replace, breast milk or formula. Avoid water for babies under 6 months. Water can be given in small amounts for babies over 6 months, but breast milk or formula should remain their primary fluid. /r/n/r/n Regardless of whether your newborn is breastfed or bottle-fed, Signs they are getting enough milk include :r/n/r/n. Signs your baby might not be getting enough milk include :r/n/r/n. Healthcare providers will assess the severity of your baby's dehydration through vital signs, weight, exams, and diagnostic tests. If your baby can keep fluids down, they might start with ORS or ESOMAL, rehydration solution for malnourished, which has different mineral levels than regular ORS. /r/n/r/n. If your baby has moderate or severe dehydration or can't keep fluids down, the healthcare team may give intravenous, fluids to restore hydration quickly. Sometimes, they use a nasogastric, NG, tube to deliver fluids from the nose to the stomach. /r/n/r/n. Watch your baby's behavior and feeding patterns to track their improvement during rehydration. Look for these signs of progress. /r/n/r/n. Signs the baby may be worsening include /r/n/r/n. Dehydration happens when a baby loses more fluids than they drink. This can occur quickly because babies need a lot of fluids and lose them fast. Common causes are illness, fever, vomiting, and diarrhea. Signs include fewer wet diapers, dark urine, dry mouth, and tiredness. To manage mild dehydration, give breast milk or formula more often and ask your provider about small sips of Pedialyte. If symptoms include severe signs like no wet diapers, unresponsiveness, or a sunken fontanel, seek emergency medical care. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.